Welcome back. The Department of Health and Human Services will spend $80 million on public health IT people. The funding initiative focuses on the diversity of the health IT workforce. Lisa Lewis is Deputy National Coordinator for Operations and Chief Operating Officer, the Office of the National Coordinator for Health Information Technology. Elise Sweeney Anthony is Executive Director for the Office of Policy at the Department of Health and Human Services. Ladies, welcome. Thanks for coming on the program. Lisa, I start with you. This is the Public Health Informatics and Technology Workforce Development Program. What do you want to develop through this program, Lisa?
We are looking to strengthen the public health informatics and technology workforce that is available across the nation. We are working to train 4,000 new public health workers, specifically in informatics and technology.
Elise, welcome. Thanks for joining me today. What will those people do, and where are you going to try to find them?
Thank you so much. It's a pleasure to be here. So the Public Health Informatics and Technology Workforce Development Program, or FIT, is really focused on identifying workforce components that are focused on those two fields, informatics and technology. Public health workers are critically important, as we know, to our landscape. It's critically important to our public health infrastructure and critically important to the overall health of the nation. So what we're focused on is identifying a diverse workforce located primarily looking at minority serving institutions to form and engage in consortiums. If they're not leading the consortium, that they are part of a consortium that's applying for these workforce opportunities. They would essentially be providing training, certificate, or degree level programs focused on those two fields, public health informatics and public health technology, really from a diverse perspective, thereby increasing the diversity of the field overall.
Lisa, how are you going to go about identifying these people, and who are going to be the stakeholders that help you identify the candidates?
So we have been working across the Department of Health and Human Services for several years to develop strong relationships with the minority serving institutions. And so, as Elise said, we are taking a consortia approach to this program. We are asking minority serving institutions to help us in this area to identify the candidates. We are asking them to be the leads of the consortia. And if they are not the lead and a non-minority serving institution is the lead, that a minority serving institution is part of that consortium. And we also ask that they work with representatives from the public health agencies, either state, county, or local, and with community organizations to engage in finding these candidates and ensuring we meet our goal to train 4,000 public health workers in informatics and technology.
Lisa, you stole my question, which is what's the volume like here? So I'll ask Elise, how will you measure your success in this program? Is it just the 4,000, or are there other ways that you're going to evaluate as the program proceeds that you're achieving what you want to achieve?
Yeah, what we're looking at is a program that really is going to meet the needs of the public health workforce overall. What are the health IT needs that are needed? So some of the requirements and elements of the program focus just on that. We focus specifically on identifying a diverse workforce, on identifying programs that are going to bring in communities, bring in whether it's clinics on the ground or organizations that are working on health disparities, as well as local, state, tribal, companies, or not just companies, but also thinking about those entities, those public health agencies across the landscape from a local level. Is there engagement? Is there engagement on public health infrastructure? Is there engagement on what is needed from an informatics and a technology perspective? I mean, we know from COVID-19 that there's a demonstrated need and importance that is needed regarding data to response efforts. Better data, including data regarding race and ethnicity, really helps in terms of response and identifying where health disparities may exist and where public health resources should be placed as well. So the goal of the program is really going to build out an infrastructure for training around those two fields of informatics and technology that will focus on those elements. We're also looking at sustainability over time. We want to make sure that after the 4-year period of this cooperative agreement, where these training programs are established, that there is also a sustainability factor so that these programs can continue to provide workforce professionals for years to come.
Lisa, the way I read this, these 4,000 people, once you identify and train them up, will go into the general public sector health IT workforce. Will there be an opportunity for you to try to recruit them specifically into HHS or other government organizations?
Yes, we are always looking for the best and the brightest. Our team at ONC is absolutely amazing, and we compete with private sector as well as state and local government for the best and the brightest informaticists and technologists. So we have a program, the Pathways to Public Service program, that we have been running for several years, along with our minority serving institutions, to do just that, recruit the best and the brightest from these institutions to increase diversity, not just in other parts of government, but also within HHS itself.
Lisa and Elise, congratulations on getting this underway. Thank you very much for joining me to talk about it.
Thank
Our
you.
pleasure. Thank you.